Hello, thank you for watching this video. This is Nurse Choma. Today I'm going to be going over with you guys how to answer NGN NCLEX questions. And so I'm excited to go over this topic with you guys to help you to better understand these style of questions. I know this is often an area that a lot of people are intimidated by, and so hopefully in this video you'll get some clarity. So if you don't already know who I am, if you just started following this page, thank you so much for following. Thank you for tuning in. The goal of our page, Choosing Nursing, is to help nurses to understand nursing content, pass the nursing exams, pass their boards exam, and become licensed registered nurses, along with also helping nurses to achieve their lifelong goals and dreams. And so I've been on this platform, fortunately, since 2016, helping nurses like yourself to become registered nurses, LPN nurses as well. And we've had a multitude of testimonies over the years, and so that's pretty much what our purpose is. If you want to learn more, you can always visit us on our website, which is choosingnursing.net. All right, so today I'm going to go over how to answer NGN NCLEX questions. And this is such a prime time because I know there's many people right now that have just you may have recently just graduated nursing school, so you're going to be thinking about, you're going to be taking the NCLEX pretty soon, so you're going to need to know the best approach when it comes to these style of questions, right? So so hopefully though the program that you went through, the program that you studied was already preparing you. I remember for me personally, in the last 6 months of my nursing program, they were presenting to us NCLEX questions. They were going over that with us the last 6 months, like the last couple of semesters. So they were getting us ready early on. You know, it wasn't where we just like took a 3-day class at the end of the semester and then go take the test. Like they were preparing us early, because especially now with the test being more challenging than it was years ago when I finished nursing school. So if you're not already familiar, there's a very important type of system or systematic approach that they've implemented when it comes to the NCLEX since April 2023. And this is the use of the NCSBN Clinical Judgment Measurement Model. All right, so let me show it to you guys. This is it right here. Okay, hopefully you can see that. All right, so this is it right there. So this is a clinical judgment measurement model. So essentially what has happened is that aside from having the nursing process, the boards of nursing, they wanted to create an approach that every nurse can utilize in order to handle clinical scenarios. So instead of it being where, okay, you know, you use the nursing process and you use your clinical thinking or your critical thinking and your own personal judgment, they decided that that was not strong enough in order to create a systematic approach that will result in better patient outcomes. So now they created this approach so that way everybody has to go through the same format to determining what should be done when it comes to clinical scenarios. So let me go over each of these 6 categories with you guys really briefly. And then also the thing about this too that's significant is that if somebody takes the NCLEX and they don't pass the exam, they're actually going to receive it in their test results. It not only will tell them which of the 8 categories they got below, near, or above passing in, it will also include as well the categories in these 6 areas that they also did below passing or poorly in. So we have the first one is recognize cues, and I'm going to show it to you guys in a second again. Recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and evaluate outcomes. All right, so here's what it looks like again on the screen. Recognize the cues, analyze cues, right? Prioritize hypotheses, generate solutions, take actions, and evaluate outcomes. So what does that mean for each of them, right? Because now with these case study like questions, you have it where it's a scenario. So like it's usually like a long paragraph, and in the paragraph it goes into detail as far as the patient's history, their symptoms, maybe their vitals, and then anything the patient may have stated, and then you will now present to you 6 different types of questions. So a lot of times people may feel a little bit intimidated by these questions, but I've actually had people who have told me that it was easier for them. But the people that told me that this type of style was easier were people that were already working as a nurse, so it kind of depends on the person. So recognizing cues. So what does that mean? So that pretty much means that if you're presented with a scenario, all right, you're able to recognize what is significant, what is abnormal for that situation, what needs a little bit closer examining, or what needs to be responded to. Okay, so like if a question says the patient is here for this diagnosis, and it lists all these issues, but these are problems that are consistent with that diagnosis, and it's not a diagnosis that's urgent, then there's a bigger picture that you need to pay attention to. So being able to recognize cues, being able to, now that you recognize, okay, this is what's wrong, this is a problem, then the next thing is now you're able to analyze those cues, right? So you're able to think, okay, this means that the patient could be going into respiratory distress, or the patient could be going into DKA or something, right? So you're able to now take whatever the thing that you assessed, whatever the assessment is, and you're able to begin to analyze what it could indicate about what's going on with the patient. Then the next thing is prioritize hypotheses. So now that you come up with a issue, right? Okay, based on everything the scenario is saying, this may be pneumonia, this may be sepsis, this may be DKA, whatever it is. So now, and sometimes there may be multiple hypotheses or multiple diagnoses, but usually it's one core problem that's going on with the patient, and you have to be able to prioritize what is most concerning now, what is most concerning first, right? So this is now where it comes into your ABC rule, all right? And I'll give you, after I go over this, I'll give you a quick example as well, right? So what is most concerning? Then, and so prioritizing your hypothesis. So I think that the patient is going through DKA now. I think my hypothesis is the patient is now experiencing HHNS, so you're coming up with a diagnosis essentially of what's going on with the patient. And I use the word diagnosis loosely because sometimes a hypothesis could be like a complication from surgery, or it could be like, oh, the patient needs to take, their meds or something like that. So you're coming up with some type of conclusion that's going on. Then you generate solutions. So now that you think it's diabetic ketoacidosis or pneumonia or whatever, or sepsis, what should be done next, right? What should be the next thing that should be done for that patient, or what would be the appropriate interventions? And that's really going to be common when there's certain type of questions on the NCLEX where it will say, with these case study questions, where as far as being able to generate solutions, it will say, okay, which of these interventions, based on the scenario, which of these interventions would be appropriate? Is it indicated, not indicated, or contraindicated, right? So meaning that, okay, indicated, you need to do this, right? Not indicated, meaning that it's not necessary to be done for this patient. And then contraindicated would be, if you do that, it's going to harm the patient, right? If you do that, it's going to hurt the patient. So so that's essentially what those 3 things mean. I've had sometimes, one thing I have seen though in the past is people that are not familiar with the meaning of indicated, I should say not familiar with the meaning of the word contraindicated. So they're not able to decipher what's the difference between not indicated and contraindicated. And sometimes it's people that English may not be your first language, which is totally fine. And that's why it's so important for you to learn medical terminology and have a vast array of that, especially if you didn't school, if you did not school in the United States, so that way you really actually truly comprehend it. Okay, and then the next thing now is to take actions, right? So take actions is going to be, okay, we're going to do these interventions because we definitely believe that it is pneumonia. We definitely believe that it is sepsis or whatever the problem may be. And then lastly is going to be evaluate outcomes, right? Evaluate outcomes. So now that we did X, Y, and Z, so we gave them the insulin, or we gave the fluids, or we ran the antibiotics, right? What would be an appropriate outcome that we're looking for, right? So for example, it could be their temperature is now normal. Their blood pressure is now within normal limits. They, they are now able to breathe better without, showing signs of distress. Their sugar levels are within normal limits, right? Being able to evaluate outcomes. And all of these, coincidentally, each of these things still fall in alignment at the bottom with the nursing process. So when it comes to this model, it's not as difficult as it may be. The things that you need to do to be successful is, one, you have to be able to take all of the clues in the question and be able to look at it and be able to assess, okay, this means this. I think what's going on with the patient is this problem now, right? Is this complication? So usually people that may be like, especially people maybe if you're a repeat test taker or you struggle with critical thinking, like critical thinking is really hard for you, then these case study questions are going to be more challenging because it's going to force you to look at a bigger picture rather than just the facts presented in front of you. So it's not enough to just look at the facts. Like, you have to be able to see the whole picture, right? So here, let me give you a quick example. Let's say I have a question, like a scenario, and the scenario says you have, let's say the scenario says this. You have a 49-year-old male that was admitted to the hospital for complaints of shortness of breath. Okay, he was admitted to the hospital for complaints of shortness of breath. He has history of asthma. He's also diabetic. Okay, and then when he came to the hospital, his temperature was a little bit spiked. It was 90. We'll say it's 100.1. All right, and then his blood pressure was 100/60. His heart rate was 110. He has also told you that he's been having trouble eating lately, and so now he's in the hospital. What are you going to do now? Okay, so everything I just said right now, that would be, for example, a scenario. So now what you have to do, instead of just taking the facts and say, okay, oh, maybe it's diabetes, that's why it's the problem. Oh, maybe it's the shortness of breath. No, you can't just take the facts. You have to combine everything I said and look to see what is the whole picture going on with the patient. And so in order to do that well, you have to be aware of the risk factors. You have to be aware of the signs and symptoms that's all associated collectively with a specific diagnosis, right? And so sometimes that's the problem, and that's essentially what the definition of critical thinking is where you can take all the signs and symptoms and you can combine it, which is now analyzing cues, and now come up with a hypothesis of what's really going on with the patient, right? Not just certain outliers. So if I was looking at that whole picture between the temperature, the vital signs, the shortness of breath, And also, yeah, pretty much all those elements, I would be thinking, oh, this could be pneumonia, right? This could be pneumonia, or it could even go into sepsis if the blood pressure continues to trend down, right? So that would be now so I pretty much I recognized the cues because I took the vitals, I took the temperature, I took the signs and symptoms, I analyzed it, and I came up with a hypothesis that it's likely possibly pneumonia or sepsis. Then now I'm generating solutions. So my solution is going to be, okay, I need to, get some fluids. We need to get blood cultures. We need to check their vitals again, monitor it closely, and see if there's also any additional symptoms or complaints the patient is having. That's generating solutions. Take action. So now I'm going to go and give them the fluids. Now I'm going to go and give them the Tylenol. Now I'm going to do all these steps. Then I'm going to evaluate the outcomes. Okay, now is their blood pressure getting higher or lower? Are they complaining of worsening shortness of breath or not? Right? So that's essentially what it is. So for you to do well with case studies, you have to be good at thinking critically. And thinking critically essentially means taking all of the cues, all right, taking all together, combining it, and coming up with a bigger picture and being able to now do the appropriate interventions. The only way you can do that well is if you have studied the content. You study the content and you're able to differentiate, oh, this is pneumonia versus this is asthma. This is COPD versus this is, whatever it is, right? So you're able to differentiate different health problems or diagnoses off the top of your head from your own understanding. That's what it's going to come down to. So for some people, that can be a challenge for them to do because they really may not be able to see the picture, and so they have to constantly be looking at the content over and over again until it finally clicks and it finally registers them. So these are some of these. This is essentially how you begin to master the content and be able to really understand the bigger picture. All right. So a couple of things I want to share with you guys today. If you need help with better learning the content, there's a couple of things I can recommend for you. The first thing, let me grab it real fast. I just dropped it on the floor. Hold on 1 second. Okay. The first thing is that I do have a couple of resources, right? So right now, if you comment the word book, all right, so you can comment the word book below this video, and I will send you the link where you can order any of our books today, where I literally go over with you and teach you how to understand the content better and see the bigger picture, right? Because some people, although you're doing practice questions, the reason why you're not seeing an improvement is because you're still not getting the bigger picture, and so the bigger picture is absolutely necessary for your success. So one of the books, this is one of our bestseller books right here, The 70 Diseases NCLEX Cheat Sheet. In this book, I go over different types of critical topics that you need to know on the NCLEX. And then also in the back of the book as well, I've also added 100 questions. All right, I've also added 100 questions for you to practice from. They're all multiple choice. All right, but it's going to help you to be able to begin to analyze and think more critically. If you want to get this particular book, just comment the word book below in the comments, and then we'll send you the link to register for it today. The other thing I want to also mention to you as well is that we do have what I call my RN Success Boot Camp, all right? Or I should say RN Success Program. So the RN Success Roadmap Program is essentially an entire program that I put together with over 6 courses, videos, modules, templates, guides, to essentially teach you every step of becoming a nurse. Everything from passing the T's all the way to passing the NCLEX to getting a job. Even I've had a lot of people who even told me that, oh, I want to pass my boards, but I also want to start a business. So it literally has everything. So this is hundreds of hours of teachings, along with also practice questions, assessments, and it's a huge, huge steal. If you want to learn more about that, comment the word roadmap and we'll send you the link for more information about that. I hope that you found this video informative. If you have a question related to anything I covered in this video, don't hesitate to comment below and let me know what your questions are. Thank you for tuning in, and I'll see you the next time.